Hi everybody, and welcome to the October installment of the My IBD Learning Partnership series with the Orlando Health, Digestive Health Institute, and the Crohn's and Colitis Foundation. On this installment, we'll be covering a seasonal theme, just in time for Halloween, Trick or Treat, debunking common myths of inflammatory bowel disease nutrition. My name is Kalee, and I am the specialty registered dietitian at the Orlando Health, Digestive Health Institute Center for Inflammatory Bowel Disease. By walking through all these different themes of IBD nutrition, I'll cover the impact that inflammatory bowel disease or IBD can have on digestion and really proper nutrition as a whole. I'll just discuss some of the healthy eating strategies that we can be utilizing while in a flare and while in remission. And then hopefully provide some evidence-based recommendations for inflammatory bowel disease related nutrition therapy. And I've kind of woven some of the questions that you all submitted when you registered for the webinar throughout the presentation. But of course, if you think of any, feel free to email the address that was provided in the registration if you have any unanswered or new questions. So firstly, trick or treat, diet caused my IBD. This would be a trick. This is not true. Diet alone does not cause inflammatory bowel disease. And while the exact cause of IBD is still being investigated, experts believe that it's multifactorial, meaning that a number of factors are playing a role here. So, the thought process is some individuals may be genetically predisposed. So there might be, some genetic susceptibility seen here in the bottom right of this diagram, increasing risk for developing inflammatory bowel disease. But then that switch is flipped when the individual is exposed to certain environmental triggers, including diet, which you can see here on the diagram. Diet and other environmental exposures can change the balance of the good and bad bacteria that live in our gut called the microbiome. They could potentially weaken the intestinal barrier, promote inflammation or other inappropriate immune responses, and could potentially lead to tissue disruption or other complications. But with that being said, although there's not sufficient research to prove that diet alone causes inflammatory bowel disease, there is growing research regarding the role of nutrition therapy and inflammatory bowel disease and supporting its impact on inflammation. Particularly when we look at the research involved in some of the most popularized inflammatory bowel disease diets. For example, the specific carbohydrate diet, the Crohn's disease exclusion diet, the Mediterranean diet, and the newer IBD AID, the inflammatory bowel disease anti-inflammatory diet. Experts suspect that the overlapping interventions of these diets really work by modulating or positively changing the gut microbiome, by repairing the intestinal barrier function and reducing inflammation through the elimination of a lot of these food additives here listed in red on the bottom, which are typically found in highest concentration in that, Americanized diet, if you will, highly processed foods. And this diagram was pulled from the IO-IBD guidelines found in the Journal of Clinical Gastroenterology and Hepatology here, suggesting that it may be beneficial to reduce intake of foods containing high concentration of some of these, food additives and preservatives found in processed foods, saturated fats, red meat and processed meats, and instead really focusing on whole foods, so unprocessed fruits and vegetables, lean protein sources, or protein containing omega-3 fatty acids, for example, from fish and different food items that may be anti-inflammatory. So although there's not research suggesting at this time that diet alone causes inflammatory bowel disease, we can still use it to our advantage to positively impact inflammation. So on to our next potential myth of IBD, or is it true? So trick or treat, there is no single diet that will work for everybody with inflammatory bowel disease. So this is a treat, it's true. There is no one size fits all approach when it comes to diet for individuals with inflammatory bowel disease. Deciding what to eat and recommending what to eat can be really challenging for those with inflammatory bowel disease. And that's because everybody's inflammatory bowel disease is different. There's no one single diet or eating plan that's going to work for everybody with Crohn's disease or ulcerative colitis. So as a result, dietary recommendations really do need to be tailored for just you, depending on what part of your intestine is affected, what symptoms you have. For example, diarrhea versus constipation, the status of your disease. What is disease severity looking like right now? Are you in remission? Are you having a flare? As well as any underlying nutrient, vitamin or mineral deficiencies, underlying dietary intolerances. The diet that is recommended to you should also take into account your overall health, your health goals and your needs into consideration. Another reason why we don't see this one-size-fits-all approach is because IBD also varies from person to person and even changes over time for each individual. So what works for your friend may not work for you, and what worked for you last year may not work for you now. And so that really does all need to be taken into account when we're recommending a diet, which is where a registered dietitian would be quite helpful. Although there's not a one-size-fits-all approach, there are some themes here that we see in terms of how foods may worsen symptoms, because patients generally do say that there are certain foods that may cause an increase in their IBD symptoms. So this slide actually shows the results of a study or a survey of over 200 patients with inflammatory bowel disease in the UK. And as part of the study, patients were given a survey and they were asked which foods made their symptoms worse. Up to 75% of patients with IBD say that they follow a restricted diet due to food intolerances or perceived worsening of symptoms. And as you can see here, the major categories of food associated with worsening of IBD symptoms included spicy and fatty foods, alcohol and alcohol-containing beverages, high roughage foods such as raw fruits and vegetables, dairy containing or milk products, carbonated and caffeinated beverages, and then concentrated sweets or sugary foods. The Crohn's and Colitis Foundation conducted a similar study called IBD Partners. Some of you all might have actually been involved in this. It included over 7,000 patients with inflammatory bowel disease, and similarly, patients were asked about diet and their IBD symptoms. And again, more patients reported foods that worsened rather than improved their symptoms, but in general, yogurt, rice, and bananas were most often reported to improve symptoms. You can see that the foods were most frequently cited to worsen symptoms were very similar to that of the UK study. And you can see high roughage foods such as nuts, seeds, fruits, and vegetables were cited, spicy, fatty fried foods, again listed, dairy products, caffeinated and carbonated beverages, again listed. So you can see some overlap. However, kind of back to our original thought here, what you may be able to tolerate is going to look different compared to somebody else. And there might be some foods on this list that you were able to tolerate in remission or when disease is under much better control compared to when disease is very active. These are just some general themes here to take into account when we are trying to identify trigger foods, particularly during active disease. So our next myth, or maybe it's true again, trick or treat, the low FODMAP diet is an effective strategy to manage inflammatory bowel disease symptoms. This is a trick. So the low FODMAP diet has not been well studied in inflammatory bowel disease. So the FODMAP diet stands for fermentable oligo, monosaccharides, and polyols. And essentially this FODMAP acronym stands for a group of carbohydrates that are poorly absorbed in the small intestine. So what happens is they're broken down and fermented by our gut bacteria, the microbiome, which typically results in excessive fluid and gas production. And so that's why for some individuals, high FODMAP containing food items can cause a variety of GI symptoms. For example, abdominal pain, bloating, excessive flatulence, diarrhea, or constipation. This is actually a diet, though, that has been primarily studied in IBS, irritable bowel syndrome, which is very different than inflammatory bowel disease. There have been 2 small studies that suggest that some patients with IBD may have improved symptoms on the diet. However, it's important to note that all of these studies looked at patients with IBD with inactive disease. So the actual impact for patients with inflammatory bowel disease that's active isn't known, and it's quite possible that these individuals with inactive IBD could potentially have overlying irritable bowel syndrome or possibly a dietary intolerance to some of these high FODMAP containing foods. So, this is a diet that could be helpful if we are in endoscopic remission, meaning that inflammatory bowel disease is well controlled, there's no active inflammation, but we're not in clinical remission, meaning symptoms are still very active, things are not matching up. That's when it could potentially be helpful to work with a dietitian to tease out if we have potential dietary intolerances still playing a role with symptoms versus active inflammation. But in the context of using this diet to manage IBD-related inflammation or primary therapy to control inflammation in IBD, the research is not there. And to kind of take a step back, when we're doing research online about some of these specific diets that may or may not be beneficial for inflammatory bowel disease, it's important to take into account that most of these diets have not been rigorously studied or scientifically proven to prevent or adequately manage inflammatory bowel disease related inflammation. Some of these diets can be quite complicated to follow or even risky due to the number of foods that need to be restricted or eliminated. And so it's so important to speak with your doctor or dietitian, especially if you have access to a dietitian, before starting a particular diet. Because like we said previously, the best diet is one that's going to meet your nutritional needs while helping you better manage your symptoms and to work with medical therapy to hopefully promote anti-inflammatory effects. So in summary, working with your doctor or dietitian can help create a diet plan that's best for you and to select, an eating pattern or specific diet that's really going to help you achieve your overall health goals and, better manage your underlying disease. So next up, trick or treat, alcohol may worsen symptoms. So this is a treat. Alcohol may contribute to worsening symptoms. And this is a loaded area of discussion here, but in general, alcohol is considered a gut irritant. So for most individuals with inflammatory bowel disease, it can be a trigger for symptoms, particularly carbonated alcohol-containing beverages, such as beer or sometimes the seltzers, and then sugary cocktails, so what you're mixing your alcohol with. Besides worsening symptoms, excessive alcohol consumption can actually worsen inflammation by compromising or suppressing the immune system. This, can potentially be true in individuals who have flared after several nights of excessive or binge drinking. Well, some patients might feel most comfortable or feel best by strictly avoiding alcohol. Some individuals might be able to tolerate alcoholic beverages in smaller quantities or in moderation. And so as you can see on this slide, the concept of moderation is generally defined as 1 drink or less a day for women, or 2 drinks a day or less for men. In general, what can help with tolerance is pairing alcoholic beverages with at least 8 ounces of water, and not drinking on an empty stomach. So pairing with food and eating ahead of time. And of course, alcohol may be contraindicated in certain cases of inflammatory bowel disease. So think, immediately post-flare, active flare, post-surgical, or just the interaction that alcohol can have with certain inflammatory bowel disease medications, or, in the case of other overlapping health conditions. So always check with your medical team, your physicians and providers, with the question of, would I be able to consume alcohol in moderation? Would it be appropriate for me and my condition? All right, next up, trick or treat. The gluten-free diet is proven to help manage inflammatory bowel disease. So this is a trick. So in the gluten-free diet is another common diet that's promoted for individuals with inflammatory bowel disease. So what's the evidence for this? The Crohn's and Colitis Foundation partners surveyed, also asking the question of who has tried the gluten-free diet and what effect did it have. They surveyed over 1,600 patients. About 19% of those reported having tried a gluten-free diet, and 8% were currently on a gluten-free diet. Of those patients, 65% reported that they felt the gluten-free diet showed an improvement of their symptoms. 38% approximately reported fewer or less severe flares. And then in addition, it was also reported that they felt it helped with fatigue. It's important to note that this was, self-reported symptoms, didn't, actually measure inflammation or inflammatory markers. And of these individuals, kind of going back to the low FODMAP diet, some of these patients could very well have underlying gluten sensitivities. You see a percentage of these patients reporting that they had actually been diagnosed with celiac disease, some non-celiac gluten sensitivity. There might be some undiagnosed individuals in the mix, or individuals that have a gluten intolerance here. So it's a little murky as to, does this actually help inflammation? Was this more symptoms that are being controlled due to underlying dietary intolerances? There's not enough research here at this point in time to really say, the gluten-free diet, it can be a therapeutic diet for IBD. It's just not there yet. I do think that there is benefit, though, considering not to go strictly gluten-free necessarily, but that, gluten oftentimes, rears its head in some of our highly processed foods. So again, kind of getting back to the basics, those themes that we were seeing in those IOIBD guidelines, showing the potential benefit of focusing on whole foods, so unprocessed fruits and vegetables and whole grains and plant-based protein and omega-3 rich protein sources, by kind of going back to those basics and really focusing on unprocessed foods. I think that there is some benefit there, but in terms of following a strict celiac disease diet for individuals with IBD, the research is not there yet really backing its benefit. Up next, we have trick or treat. IBD may increase my protein needs. And this is a treat, this is true. So protein needs may be elevated in certain stages of inflammatory bowel disease status. So, kind of going back to the role of protein, it's a really important nutrient that the body needs, particularly after healing from surgery, but also coming off of an inflammatory bowel disease flare or during times of active inflammation. It serves as a huge kind of building component for bones, muscles, skin. It's important for growth, important for tissue repair. It also serves as a good source of a number of nutrients. And as a result of these conditional needs of our body during times of active inflammation or post-surgery or post-flare, we may require more protein. And then, kind of at maintenance, long term, our needs start to normalize. Unless we have overlying, we have like a history of past surgical resections, then our body still might, or we have an ostomy, then our body still might need a little bit more protein just due to decreased, ability to really absorb the nutrition that we need from food, including protein, or if we're losing potential protein by, high ostomy output, then our needs might be a little bit elevated. But in general, coming off of a flare and maintenance, if we've been in remission for a good bit, then, we fall back to kind of baseline level needs of protein. In general, choosing lean meats or low-fat proteins can help with tolerance and kind of align towards overall health goals. And you can see kind of broken down to the serving sizes of protein listed on this slide. So in general, under the recommended foods, you'll see some lean sources listed. So think fish, skinless poultry, eggs, tofu. You'll see smooth nut butters listed. Chunky might be a little difficult to tolerate during times of active inflammation in particular, or active symptoms. You'll see low-fat dairy listed, and we'll talk about dairy in just a little bit. You'll see like vegetarian meat alternatives such as tofu or soy protein alternatives. You'll see hummus, pureed bean dips, or even like the bean and lentil-based pastas. Sometimes the broken down forms of beans and legumes are a little better tolerated. And then, of course, supplementing with protein shakes or smoothies as needed, particularly during times of active inflammation if solid food intake is difficult to tolerate. The foods to avoid, this is particularly during times of active inflammation, where tolerance might be, limiting a little bit. So especially the tougher, more fibrous meats. So think of meats that require you to cut through with a knife and you're chewing and chewing like a tough steak. Or intact, like beans and legumes if you have tolerance issues. But in remission, you might be able to tolerate intact beans and legumes, like cooked beans and legumes, just fine. So again, these are just general recommendations of what foods may be better tolerated, especially during times of active symptoms. So on to the topic of dairy here. Trick or treat, dairy should be avoided. So this is a trick. Dairy does not necessarily need to be strictly eliminated. Kind of going back to the purpose of dairy here, dairy contains calcium, which is really important for bone health. It reduces the risk of osteoporosis, which is especially important in the case of chronic steroid use or medications that may put you at risk for osteoporosis or osteopenia, so the softening of bones, and it plays a big role in muscle functioning too. And dairy contains a lot of really valuable nutrients. Some people with IBD may have underlying lactose intolerances, particularly if we have small bowel involvement. But most individuals don't necessarily have to eliminate dairy. Dairy does not cause inflammatory bowel disease flares. Now, if we're lactose intolerant, then we could certainly, choose lactose-free products. But it's also important to take into consideration that lactose-free does not mean dairy-free. They're two different terms here. So lactose-free is free of the milk sugar lactose that essentially is not broken down well by our bodies. We don't have enough of the lactase enzyme needed to break down the milk sugar lactose. So, oftentimes lactose-free products are still cow's milk products. It's either been filtered to remove the lactose or treated with that lactase enzyme to remove the lactose. Dairy-free essentially means that it does not even contain the cow's milk protein. So typically these are plant-based dairy alternatives because not only is it free of the milk sugar, the lactose, but it's also free of the milk protein. So think oat milk, soy milk, almond milk, coconut milk. I've even seen banana milk. So they're two different terms. One, dairy-free is going to be more restricted than lactose-free. Typically, if we are having some intolerance, it's most often the lactose, so we could go for a lactose-free product. But in some cases, we're able to even tolerate trace amounts of lactose. Sometimes there's just a tipping point. So when it comes to dairy, in the yogurt family, for example, Greek yogurt is fermented. That's why it's a little thicker in consistency compared to regular yogurt, and as a result it tends to be a little lower in the milk sugar lactose and higher in protein. Kefir is also a highly fermented dairy product, and it's a good probiotic source. Most hard aged cheeses are aged for so long the milk sugar breaks down over time, and most of them are almost completely lactose free. So sometimes, there's a tipping point. Trace or little amounts of lactose can be better tolerated, but if we were to drink a big regular glass of milk, that might be a different story. So all in all, when it comes to IBD-related inflammation, there's not enough evidence to support that dairy causes flares. And even in the context of lactose intolerance, dairy might not need to be strictly eliminated. So, talk with your provider about what your needs might be, lactose-free, dairy-free, or maybe even just being cognizant of the lactose that you are consuming. Because this is another example of why diet really needs to be tailored. Next up, trick or treat. Fiber may manage symptoms, or may help manage symptoms of my inflammatory bowel disease. So this is a loaded topic here, but I'll say treat depending on the type of fiber and carbohydrate. Fibers and carbs may be helpful strategies to better manage IBD-related symptoms. And the main reason why some foods are IBD friendly, we'll say, versus might aggravate symptoms a little bit, a lot of it really stems to the type of fiber that we're talking about here. So there's two types of fibers. There's soluble fiber, which essentially when we consume soluble fiber, it dissolves in water. It forms almost like a paste or gel-like consistency in the bowel. It helps absorb some of the extra water in the GI tract. So it can be quite beneficial if you're more prone to looser stooling. It slows down how quickly things move through our gut. It can actually increase absorption. So it's quite helpful with regularity, stool consistency, and even absorption of food. Examples would be things like cooked carrots, apples without the skins, oats. On the flip side, insoluble fiber behaves quite differently. It does not break down into water. So think some of these really crunchy foods that you're chewing, it just does not break down very well. What happens when it's moving through our gut is it actually pulls water into the GI tract. It can increase bulk. It speeds up how quickly things move through our bowel. It can be helpful in some cases of constipation, but because it increases movement of food, it can decrease absorption, which can work against us if we're looser stooling prone or have faster transit times, which we typically do in cases of inflammatory bowel disease. And examples of insoluble fibers would be things like Brussels sprouts, cabbage, kale, like wheat bran. So like think brown breads and grains where that outer germ of wheat, for example, is still intact. So wheat bran, think intact nuts and seeds and celeries, and why these fibers can be problematic is they're just too difficult for an inflamed bowel to handle. Think of the open ulcerated areas we have during active disease and how that might actually further irritate or exacerbate looser stooling. But certainly there are preparation strategies that we can utilize to help make insoluble fibers more tolerable. In general, fiber needs are going to vary, but in general, when we're not inflamed, when we're in remission, the recommendation for daily fiber intake is 25 grams for women and 38 grams for men, ideally contained from food. You know, it was kind of an old school recommendation that if you have inflammatory bowel disease, you always need to be on a lower fiber diet. But you know, now the Academy of Nutrition and Dietetics, the Crohn's and Colitis Foundation, the World Gastroenterology Association all agree that fiber does not need to be restricted in patients with inactive inflammatory bowel disease unless you are at risk for obstruction. Now, when we're experiencing active inflammatory bowel disease, it's generally recommended to follow a lower roughage diet, so lower in insoluble fiber, so the rougher fiber category that we were discussing, because certain types of fiber can increase symptoms like abdominal pain, diarrhea, bloating, and gas. In working with a dietitian especially can help not only with the reintroduction of fiber, but also kind of adopt an anti-inflammatory eating pattern to be a little lower roughage. So how can you change the texture, the form, the consistency of foods? Generally, what can help with tolerance of reintroducing fiber after you've been in a flare and potentially followed a lower fiber diet would be slowly increasing fiber intake once you are feeling better. So think a few grams of fiber change a week, and then make sure that you're hydrating really well. That's also going to help with the digestion and tolerance of fiber. So firstly, let's talk about whole grains. When it comes to kind of fiber intake. So grains play a really important role in terms of being that preferred energy source actually for our brains. Whole grains are also a really valuable nutritional source, and whole grains as well has big implication in terms of diet health, promoting a healthy digestion, reducing risk for various chronic diseases. In general, when we're in a flare, certain whole grains, meaning if they're high fiber, over 5 grams of fiber per serving, like whole wheat bread, may be a little difficult to break down and digest, but there are some, kind of moderate containing, so think, around 2 grams of fiber per serving that would still provide some whole grains for general health, but, wouldn't promote intolerance issues. So you'll see listed on this slide some recommended foods outside of just the white bread, which if that's the bread that you tolerate best, it's going to be very low fiber. But if you want to introduce some whole grains without aggravating symptoms, you could consider trialing something like oat bread or sourdough bread. And of course, you'll see things like oatmeal or millet, different gluten-free pastas on here, just because those tend to be a little lower fiber compared to whole wheat pasta. Not necessarily because you need to be gluten-free, but think brown rice pasta or corn-based pasta. You'll see grits listed on here as well. And then on the right-hand side, the foods to avoid, you'll see highly refined and sweetened grains. Again, kind of going back to the concept of trying to steer clear of regular intake of processed foods for potential role of inflammation long term, and then only kind of being conservative with the high fiber grains, again, if we have active disease, symptoms, inflammation, but of course these are foods you can work towards reincorporating once disease and symptoms are under better control. In terms of our other big fiber category here, we have fruits and vegetables. And of course, I'm sure most of us know here that fruits and vegetables are associated with a bunch of different positive health outcomes and lower disease risk, and just for how they're jam-packed with nutrients for our body. Fruits and vegetables can be an intimidating category for some individuals with inflammatory bowel disease. In general, what can help with tolerance if we have active inflammation and symptoms is, again, thinking back to the insoluble fiber group, the skins of raw fruits and vegetables, the intact seeds, thinking about how we can prepare fruits and vegetables to make them a little more tolerable. So think cooking, pureeing, mashing, steaming, sauteing, peeling the skin, avoiding the seeds. And that goes for fruits and vegetables. And then blenderizing, so either into soups, into smoothies, thinking about using the stock or broth of vegetables, cooking your rice or your pasta in it. And then steering clear, again, especially when symptoms are active here, from vegetables that might be, symptom promoting. So think cruciferous vegetables that are a little higher in sulfur and fiber. So Brussels sprouts, broccoli, cauliflower, maybe vegetables with tough skins. In the fruit family, think dried fruits, as sometimes these can be a little promoting of gas. Think fruits that are canned in heavy syrup or with a lot of added sugar. Canned fruits in general can be a great source of nutrition, but just be cognizant of what it's canned in. And then again, fruits that have really thick membranes or seeds. So think like raspberries or blackberries, where it's pretty hard to avoid the seeds there, unless we were to cook and strain and use for baking or making a jam or blenderizing. And again, these are foods that we can work towards, like the dried fruit, some of the berries, some of the higher fiber vegetables. Once disease is under good control and we're in remission, we can certainly have a goal to work our way back to a salad, or to work our way up to having some berries and some yogurt or something. This is more so when symptoms are active. Some recommended foods that are generally well tolerated, even during times of active disease, would be things like our root vegetables. So things like parsnips, carrots, potatoes, beets, turnips, like green beans, the squash family, including zucchini, cucumbers, pumpkin, yellow squash, acorn squash, cooked asparagus tips. For fruit, think like melons, like watermelon, honeydew, cantaloupe, avocado, which is technically a fruit, mango, papaya, bananas, peeled apples and pears, peeled peaches and nectarines. These are going to be fruits that are a little easier to digest and lower in that insoluble fiber category. And when it pertains to fruit, ideally we would like to consume whole fruits when possible versus fruit juices, as oftentimes the juices can be sources of just a high sugar load at one point in time. Some individuals with IBD have an intolerance to sugar, and that's because consuming too much sugar at one time, or from day to day, can potentially cause an imbalance of gut bacteria, can contribute to digestive upset, can even potentially promote inflammation. When I say sugar, I mean added sugars, refined sugars. Think the sugars and syrups added to food traditionally during processing. Typically, these items are what I refer to as empty calories. So, the calories found in these foods are typically low in nutrients. So they're really not providing much nutritional value. They're not fueling your body well or for very long. And really not keeping you full or satisfied for long either. And this is true both during times of active inflammatory bowel disease and even inactive inflammatory bowel disease. Can potentially contribute to hydration issues as well. In general, I recommend aiming for less than 25 grams of added sugar intake daily. And when we're thinking about hydration, so going back to the juice, think of some alternatives to hydrate yourself. So think fruit-infused water instead of juice, or if you do like juice, maybe consider diluting it 50-50 of water to fruit juice. Think of G2, so like a lower sugar Gatorade or even oral rehydration solution instead of Gatorade. What I mean by oral rehydration solutions is essentially glucose electrolyte solutions that hydrate our body a little better compared to regular sports drinks, which tend to be a little too sugary, or water, which is a good baseline hydrator but doesn't contain any electrolytes to really help rehydrate. These are some examples of recipes if you prefer to make your own or prepare things in bulk. Some common over-the-counter products include Pedialyte, Drip Drop, Liquid IV, or actually Gatorade just came out with a product called Gatorlyte. And again, these products just really work with our body in order to maximize how we hold on to fluid best. And would be a good alternative to something like a regular sports drink like Gatorade in terms of hopefully avoiding GI upset and promoting hydration. So last but not least here, we have the question or trick or treat here. Restructuring intake throughout the day may help better manage symptoms. This is true when done appropriately. So appropriate restructuring of eating throughout the day may help with symptoms. So this does not mean, I'm going to avoid eating for a certain period of time because I don't want to have symptoms afterwards. This means instead I am really having difficulty tolerating breakfast, lunch, dinner. I think I'm going to split up what I'm eating throughout the day and follow a smaller, more frequent meal pattern, which some individuals with inflammatory bowel disease really benefit from. Another indication where this might be helpful is individuals that are at risk for a bowel obstruction, such as patients that have stricturing or narrowing in different parts of their gut. By eating smaller, more frequent portions, this could actually reduce risk of food getting stuck or becoming obstructed. And this is because large meals generally do increase that risk. By kind of splitting up intake throughout the day, you're reducing kind of the burden of digestion on the gut. This is also a helpful strategy for individuals that have a hard time from what's called early satiety or getting just overly full too quickly. From experiencing symptoms like abdominal pain, urgency, nausea, vomiting, diarrhea after eating. Smaller, more frequent meals may help you actually kind of get in enough calories and nutrients and protein within a 24-hour period. But, all of this is to say that small, frequent meals don't work for everybody. So first of all, we want to be intentional about what we are eating. We want to avoid some of those empty calories. Think about getting in nutrient-dense foods, protein-dense foods. But even then, that's not going to work for everybody's meal or day-to-day schedule, or might not even be appropriate, especially for patients that don't have a lot of active symptoms, or maybe if you're more prone to constipation. So actually in those individuals, we may be able to eat 3 meals a day with no problem. It's not necessarily recommended for everybody. Actually, if you're more prone to constipation, eating larger meals, like less frequently throughout the day, so 2 to 3 decent-sized meals a day may actually stimulate movement throughout the colon and promote a more complete bowel movement. In terms of when we are eating throughout the day, another helpful strategy is to also take into account mindful eating. So being fully aware of what you're eating and drinking, really taking into account how the food tastes, what it makes you feel during eating, chewing our food well. And this really does help in terms of how you feel afterwards. It creates a lower stress eating environment, which we know that stress and different environmental factors can affect GI symptoms. So eating slowly, chewing foods thoroughly, this is really helpful, particularly if we're at an increased risk for obstruction or if we're really inflamed. But in general, this can be a helpful strategy regardless of active versus inactive inflammatory bowel disease, and can help with symptoms. So to summarize, and I included this slide in here because I got a question from a registrant that was basically, asking, I was newly diagnosed about 2 months ago. I've started to change my diet. I've started taking different vitamins. I really don't want to have any more complications. What should be my next step? Firstly, in terms of taking different vitamins, I would recommend working with a gastroenterologist to regularly check for vitamin and mineral levels, and to rule out things like anemia, to catch different nutritional deficiencies early. And then I would recommend getting a dietitian on board. So either calling your insurance if your practice doesn't have your gastroenterology practice does not have a dietitian on team, to hopefully find one in your area. Eatright.org also has a dietitian provider on their website. But by getting a dietitian on your team, hopefully between them and your gastroenterologist, you all can really work together to not only identify nutritional deficiencies, but identify the factors, kind of the driving forces behind some of these nutrient losses, and recommend replacement, either in the form of supplements or, in the form of dietary changes, so food or, different shakes. And really work collectively with you to optimize your nutritional status, because we know that optimized nutrition can improve health, it can improve healing, particularly after surgery or coming off of a flare. And by doing all of this, hopefully making healthy nutritional choices can really help complement medical therapies that you're embarking on as a newly diagnosed patient, and really optimize your overall health status to work towards some of your goals. For example, preventing further complications, and for hopefully bettering your overall nutritional status. If you have any trouble finding a dietitian with expertise in GI or, IBD, you can also reach out to the email again listed in the this My IBD Learning Partnership installment, and I can also help facilitate with that, because I think it does really play a positive role in providing that well-rounded care as an IBD patient. For any other questions, feel free to send them to the address included with this event registration, and I will get to them as soon as possible. And with that being said, thank you so much for attending and for your time.